Medical Education 1. Medical education in the UK. Medical education in the UK covers undergraduate education for around 5 years at medical school, the section of the university responsible for medical education. A 2-year foundation program with provide training for a new doctor after graduation through a series of placement in different specialties. See Unit 12, Postgraduate Training, which doctors take to become GPs or consultant senior specialists, often delivered those colleges for different specialties. For example, the Royal College of Physicians. Continuing professional development in the form of course and seminar which doctors undertake. Throughout the working you to keep up to date, Stratford and other graduate prospect. The MBCHB Bachelor of Medicine of Surgery is a 5-year undergraduate medical degree course. Most of the youth learning takes place in a small group. The main components are called years 1-3, an integrated program of clinical and scientific topics mainly presenting those problem-based learning PLV with other unactivities of the word problem. The student selected module essences allow you to choose from a menu of subjects such as sport, medicine, or even studying a language as preparation of an overseas elective. Hospital attachment after your choice between years 4 and 5. Vocational studies and clinical school. This component purpose job for the clinical scale. We qualify for contact with patients from year 1 of your course to period of practical training, where you are attached to a hospital, department, or general practice. Clinical assessment, year 4 and 5, a series of work with clinical attachment in medicine, surgery, psychological medicine, child health, obstetrics, gynecology, and general practice. A student view. Ellen, a medical student, described Jer's course. Just finishing my first year of medicine. What I like about this course is that you're involved with patients from the very beginning. Even in our first year, we spend time in hospital. Most of the course in Playby. We have 2 hour sessions and we work in group of age to take solving clinical problems. We decide together how to tackle problems, look up book and online sources, make notes and discuss the case together. A great way for learning and growing to know the other students. In the past, medical students had lectures with the whole class talking out from lecture from 9 to 5, but knowing mailing group. Although we do have some lecture and seminar where we work in a small group with a tutor. I like of it even the decision. We had to go out cadaver from the second month of the court. Educación médica, número 1. Educación médica en el Reino Unido. La educación médica en el Reino Unido cubre la educación de pregrado, cuando 4 o 5 años en la escuela de medicina, la sección de una universidad responsable de la educación médica, un programa básico de 2 años que brinda capacitación para nuevos médicos después de graduación a través de una serie de prácticas en diferentes especialidades. Formación de posgrado que los médicos toman para convertirse en médicos generales o consultores. Generalistas, a menudo entregados a través de colegios para diferentes especialidades, por ejemplo, el Real Colegio de Médicos. Desarrollo profesional continuo en forma de cursos y seminarios que los médicos emprenden a lo largo de su vida laboral para mantenerse al día. Extracto de un proceso de posgrado. Licenciatura en medicina, licenciatura en cirugía. Es un curso de pregrado en medicina de 5 años. La mayor parte de su aprendizaje tiene lugar en grupos pequeños. Los componentes principales son un programa integrado de temas clínicos y científicos presentado principalmente a través de aprendizaje basado el año de su PLP, donde trabaja con otros en una serie de problemas. Los módulos seleccionados por el estudiante se permiten elegir de un menú de asignaturas como medicina deportiva o incluso estudiar un idioma como preparación para una maestría adjetiva en el extranjero. Un vínculo hospitalario de su propia elección entre los 4 y 5 años. Estudios vocacionales y habilidades clínicas. Este componente le prepara para habilidades clínicas en problemas requeridos para el contacto con pacientes desde escasos cursos a través de periodos de capacitación práctica en donde está adjunto a un departamento hospitalario o práctica general. Adjuntos clínicos, años 4 y 5. Una serie de adjuntos clínicos de 4 semanas en medicina, cirugía, medicina psicológica, salud infantil, obstetricia y ginecología y práctica general. La opinión de un estudiante. Ellen, una estudiante de medicina, describe su curso. Estoy terminando mi primer año de medicina. Lo que me gusta de este curso es que te involucres con los pacientes desde el principio. Incluso en nuestro primer año pasábamos tiempo en el hospital. Gran parte de un curso es PLB. Tenemos 2 sesiones de 2 horas a la semana donde trabajamos en grupos de 8 a 10 resolviendo problemas clínicos. Decidimos juntos cómo abordar el problema. Buscamos libros y fuentes en línea, tomamos notas y discutimos el caso juntos. Es una gran manera de aprender y conocer a los otros estudiantes. En el pasado, los estudiantes de medicina tenían conferencias con toda la clase, tomando notas de los profesores de 9 a 5, pero ahora es principalmente trabajo en grupo, aunque tenemos algunas conferencias y seminarios donde trabajamos en pequeños grupos con un tutor. Me gusta todo, incluso la dirección. Llegamos a cortar cadáveres en el segundo mes del curso. Match these activities to the stages of medical education in the UK, given in a opposite. Dissecting cadavers undergraduate, keeping a lot of surgical procedure, usher and perform postgraduate, working for 4 months in accident and emergency to experience this specialty foundation program. Talking a 4 gig attachment in obstetrics and gynecology. or the graduate, taking an online course on recent development in cardiovascular disease, continuing professional development. Complete the sentences. Look at B and C opposite to help you. Just before their final year, students have the chance to take a lecture in hospital of the choice anywhere in the globe. Problem-based learning contract with an approach where each subject is taught separately. These days lectures are often interacting with regular opportunity for the student to ask questions. In clinical attachment, students learn how to treat and manage patients. Students selecting module can be a topic from outside medicine, such as flooding, allergen. Dissection of cadaver is an important part of the anatomical component. The medical charts at the University of Edinburgh in Bank of the Order in the UK. She is a consul at the Royal, one of the leading pediatric nerve specialties in the country. The Royal College of Surgeons in Edinburgh dates from 1505. We had a seminar in which where we discussed topics in a small group with of lecture. March in after activity to one of the components of the undergraduate course described in BNC opposite. Julius spent it with working in a small hospital in the Knowledge Overseas elective. A group of students discussed together a possible reserve of abdominal pain after meal in August 44 when old male problem-based learning building. A small group of students traced the formulary early in a calibrate session. Arrow spent a month working in the pediatric ward of the Plucker Hospital, a clinical attachment, and learned how to take blood from an elderly patient clinical skull. Human chooses to study travel medicine in his fourth year student selected module.